What is hepatitis B? Hepatitis B is a dangerous liver infection which spreads by the hepatitis B virus. For some individuals, hepatitis B remains acute, while for others it turns into a chronic disease lasting for around 9 to 12 months. Chronic liver infections due to hepatitis B have a high chance to turn into liver cancer, cirrhosis, or liver failure. Most of the adults suffering from hepatitis B usually recover entirely without any long-lasting effects. However, children and infants are at a higher risk of suffering from chronic infections. There is no permanent cure for hepatitis B, but you can prevent yourself from getting hepatitis B through vaccines. Hepatitis B infection is either short-lived or long-lived, depending, that is, acute or chronic. Acute infections last for less than 6 to 7 months, where the immune system fights against the virus and offers complete recovery. Chronic diseases, on the other hand, continue for more than 6 months. If they keep on lingering, the immune system is unable to fight against them, leading to a debilitating condition. The signs and symptoms of hepatitis B range between mild, moderate, or severe. They appear between 4 to 16 weeks once you get infected. The symptoms of hepatitis B include abdominal pain, joint pain, fever, dark urine, appetite loss, vomiting, nausea, yellowish discoloration of the skin and the eyes. It is crucial to visit the doctor as soon as possible once you suffer from the infection of hepatitis B. If you receive the treatment for hepatitis B immediately within 24 hours, you are at a lesser risk of suffering from severe signs and symptoms. The ultimate cause of hepatitis B includes the hepatitis B virus, which spreads from one person to another through body fluids like semen, blood, or others. The conventional ways of HBV transmission include contact, where you undergo unprotected with an infected person. The virus can pass through the saliva, blood, semen, or vaginal secretions of an infected person. Other ways of HBV transmission include needle sharing or the use of contaminated syringes which have the infected blood. Accidental needle stick injuries can also result in HBV transmission. Mothers can also spread the disease to the children when they are pregnant through childbirth. To prevent the transfer of the virus to the newborn, he or she can be vaccinated as soon as they are born to avoid the spread of the infection. The risk factors for hepatitis B include needle sharing, unprotected childbirth from an infected mother, and traveling to areas with a high risk of hepatitis B transmission. Also, jobs like being a dentist where you're at a high exposure to a patient's blood, or even living with an infected person, make you prone to high risk of hepatitis B transmission. The severe complications with HBV infection include liver cirrhosis, where there is scarring of the liver, increased chances of liver cancer, liver shutdown, where the liver is unable to perform essential functions, kidney disorders, and inflammatory diseases of the blood vessels. The only way to prevent hepatitis B is to get yourself vaccinated. The vaccine for hepatitis B is commonly recommended for newborns, children, adults, people working in a place where there are disabled people, those living with a hepatitis B infected patient, emergency or healthcare workers, people who have more than one sexual partner, a person who shares needles or syringes, and people suffering from chronic liver disorders or kidney disorders. Take precautionary measures to avoid HBV infections, like knowing the status of your partner, avoid any use of illegal drugs, and be cautious during tattooing or body piercing. The diagnosis of the hepatitis B virus involves physical examination, medical history, blood tests, liver ultrasound, liver biopsy, and others depending on the condition. For treatment, there are various supportive measures with lifestyle changes that help in coping up with the symptoms. Keep yourself connected with others and take good care of yourself, especially through dietary changes and rest. We hope that you are learning something new every day from our videos. If you'd like to know about a specific topic, inbox us, email us, or comment down below.